While more and more women are embracing the joys of aging, we are still looking for ways to ease the aches and pains that come along with it. One of those ways is through bioidentical hormone replacement therapy. I'm at Low TE, Florida to speak with Carolyn Zomeyer to learn all about optimizing our hormones. Let's go check it out. I'm here with Carolyn Zomeyer, bioidentical hormone expert and owner of Low TE, Florida. Thank you so much for your time.
Oh, it's my pleasure. It's so good to see you.
So good to see you. So I know we're talking more about hormones in the media, about the ways that they affect our bodies. What are the benefits of hormone optimization?
Oh, there are very many, and everybody's experience through this wonderful time is different, very unique. And so what many people, when I first started with Low TE Florida, I thought the big driver would be sex drive, ED, and all that for low testosterone. But the number one reason people schedule with me is usually for fatigue. They're just feeling tired. As our hormones naturally decline with time, we lose our energy, we lose our mojo, our motivation, and that's the biggest thing. People aren't sleeping well, so that contributes to the fatigue, lack of energy, reduced mental focus. I have this one male attorney I've been correcting for years that says he notices when he's due for his next treatment when his brain fog returns and he loses his focus. And so he'll be working on a project, but his brain is going this way and that way. And he says after he gets his treatment, brain fog lifts and he's able to focus and compete with the younger guys.
Oh, yeah.
Yeah. And a lot of people feel moody, anxious. You know, I sometimes feel bad for your partner because the person you turn into with menopause or andropause, the male version, isn't the same person that they married. And so if we can bring back that person, it really can help with the relationship. And I have this one couple I've been treating. They've been married well over 30 years, and they termed it hashtag pellets for life because it made such a difference in their relationship, you know, because it does increase your sexual thoughts, your sexual satisfaction. You want to have that loving relationship again. And so we've saved a lot of marriages with this. Guys will notice, and women will notice, their muscle mass decreases, and so and we don't want that, and it's not healthy. It's called sarcopenia, and we don't want that as we age. We want to have good, strong muscles to protect us if we fall, just to pat us, or just to be able to lift things and be active, play with the grandkids, whatever you want to do. We have so many pickleball players now,
Right,
so
right.
this helps them with that. And a lot of people notice as their hormones are declining, gaining weight around the middle. And that's due to not enough hormones. And so being able to help people regain their figures from the past is fun. And, you know, it's so much fun because I love my practice because I get to see people at their worst. They come in when they haven't had treatment and they're feeling poorly. And sometimes I'll be crying or having a hot flash in my office, you know, and it's emotional, and so they're not feeling well. So I talk to them and I make promises that I'm going to help you feel better, and then when they come back 6 weeks, 4 or 6 weeks for their lab work, they feel like Superman or Superwoman. So to be able to make change like that in people's lives has been very, very rewarding. So as you can hear, we have receptor sites for these hormones all throughout our body. And when we bring them back in, it's kind of like turning back the clock, maybe 10, 15 years. So it's, like I said, it's a personalized, different journey for everybody, and that's why our treatments are personalized. It's not a one size fits all. You know, like if you go to traditional medicine, they'll write you a prescription that they've written for the 10 ladies before them for a synthetic hormone, or even maybe for an antidepressant.
Right. Yes, that happened to me.
Yeah, you're not depressed, you're having hot flashes, but they think that's the answer. So we treat the root of the problem, just giving you back what you used to naturally produce. The word bioidentical stands for biology, is the bio, that our products are derived from wild yams and soy. And then identical is referring to the chemical molecule. The octagon with the lines that from chemistry is exactly the same as what our ovaries used to produce and the testes for the men. So when we bring it back in, those hormones fit into the receptor sites all throughout the body like a lock and key. So your body is just kind of convinced that you're naturally producing these hormones again, and you get those results. Your muscle mass changes, your workouts are better, your energy's better, sex is better, everything's better.
Yeah. Well, and you kind of just touched on this, but hormones were getting kind of a bad rap, and it was
yeah.
these synthetic hormones, and those are
Exactly.
different from the ones.
Absolutely. That was there's a huge test, a huge research study called the Women's Health Initiative, and it was started I think in 2019, but by 2002 they had to halt the study because the results were so horrific. And what they were seeing was heart attack, stroke, deep vein thrombosis, and breast cancer, and even Alzheimer's developing in these women. And so they stopped the study, and then it hit the press like estrogen is, kills women. And once we dissected the study, the women that were on estrogen alone did great. They had better cardiac issues, less breast cancer, everything. And the women that had the progestin, whenever you have bring in estrogen of any type and you have a uterus, you always have to oppose it with either a progestin or a progesterone. And they were using a synthetic version of the progestin, and that was the problem. It's the same as what they use in a lot of birth control pills. That's why we always have the warning with birth control pills about, look for a blood clot in your leg, watch out for deep vein thrombosis. It was because of that synthetic progestin. So it wasn't the estrogen, but now to get the newspaper to print that estrogen is healthy for women, it is good for women, seems to be impossible.
Right. Right.
So I'm trying.
Yes. Well, and I think your pellet system is so interesting, and the way that the hormones are delivered to the body. So will you explain pellets a little bit?
Yeah. There's several different ways of getting the hormones into your body. You do shots, you can do troches, which are little dissolvable things in your mouth, patches, different ways of getting it in, creams. But the best way, the safest way is the pellet. And I've tried all the other ones and never really felt well till I got the pellet. The pellet is just compacted hormone, and it's compacted to like 800 psi, very tight pack of just hormone that gets inserted underneath your skin, either in your upper outer quadrant of your buttock or in your love handles for guys. And when the blood supply passes by the pellet, it gently raises your hormone levels up during the first 4 to 6 weeks and then holds them steady for 3 to 5 months for women and 5 to 7 months for men. So some men only have to come in maybe twice a year for the treatment. The pellet delivery system is the safest because it's not doing a first pass through the liver. It's just gently bringing it in. Any of the other ways of getting the hormones into your body gets this huge dose of chemical that it has to process, your liver, your kidneys, your heart, and it's just not as healthy as what we do with the pellet. And we've had very good success with it. I started pelleting here in South Florida in 2013. And I've always ranked as #1 in Florida as far as how many procedures, because I've totally devoted my practice to it. A lot of people add on hormone therapy as just a way to make a little extra cash for the practice, but this is all I do every day. And so nobody can have a untoward effect that I haven't had to deal with. I've pelleted over 20,000 butts. My mother is very impressed with that. She's 90. She's like, how many butts?
So great. Yeah. No, you are very good at it because I've had you do it to me, and you're very quick.
Yeah, and painless, hopefully.
Yeah. No, it is. Yeah, it's painless. It's a quick recovery. Yeah. I feel the results almost instantly.
Yeah. I do too, because I know that once it's in, I'm going to feel better, because I forget to put myself on the schedule. Then all of a sudden I don't feel well. My mood is down. I'm snappy. I'm saying things I shouldn't say, and I'll never apologize. And, kick out my husband and his dog. And then I'll realize I need a pellet, because I'm just not myself, because for me not to want to come to work, there's something wrong. And so then I know I need my pellet.
So we kind of talked about some of the myths about pellets or hormone therapy. So testosterone, people are surprised that women need that.
Yes.
And what are some of the other myths?
Yeah. Let's see, that women on testosterone will grow a penis or a beard. I've been on them for 10 years, no such thing.
Right.
I don't know. There's the cancer scare. Everybody's afraid of hormones and cancer. Years ago, it was taught in school, medical school, and it may still be taught that testosterone, a high level of testosterone, causes prostate cancer for guys. So that's scary. Nobody wants prostate cancer, especially if they saw their father go through it or whatever. But that's been totally debunked. There's a doctor at Harvard, Dr. Abraham Morgentaler, that has devoted his life to testosterone research. He actually uses the testosterone pellets to treat prostate cancer. It's very supportive to the prostate. And if you think about it, a guy's testosterone is their highest when they're 19, 20, early 20s. They're not they don't have prostate cancer. It's their fathers or grandfathers that are experiencing it that have low testosterone, man boobs, belly fat, low testosterone. That's what it kicks in. So it's healthier for your prostate to have a youthful level of testosterone. And for women, breast cancer, that's always been the big, I hear it every day when I'm doing consultations with new patients. But what about breast cancer? It doesn't, well, what I do does not cause breast cancer or make it grow quicker. Mm-hmm. And I've had that, I've spoken to every expert that I know and asked them straight out, is what I'm doing causing cancer? They say, absolutely not. I said, does it make it grow quicker? Because I don't want to cause harm. I don't want to give anybody breast cancer. I'm taking it myself. Mm-hmm. I don't want to have breast cancer. The thing with breast cancer is interesting to me is that, and a lot of people don't know this, is from the time the cells decide to go bad, turn into cancer, till you can actually find it is 7 to 10 years. Wow. So if I pellet somebody today and 2 weeks later they're diagnosed with breast cancer, oh, the pellet caused it. No, it was coming down the pike. And so what we do is we insist that everyone have an annual mammogram, because early detection saves lives. Mm-hmm. And it's not that what we're doing causes it, but part of the treatment for breast cancer is they want to drive the estrogen down. So it would delay their treatment if we were to pellet somebody. That's why we have to have a good mammogram before we even start. Pellet somebody, then they get diagnosed and it would delay treatment. So that's why we lean on them for the mammograms, because I get people saying, well, if it doesn't cause breast cancer, why do I have to have a mammogram? Well, you still could get it, mm-hmm. with or without hormones. Women are getting breast cancer every day. And the interesting fact is that over 60% of the women being diagnosed with breast cancer have never taken hormones at all. So it's not the big driver that we tend to think it is.
Mm-hmm. You brought up something. I started seeing other businesses offering pellets as like an add-on. Yeah. And the idea that you wouldn't be going to an expert for something like this.
Yeah.
I tell friends, I'm like, you must go see Carolyn. She's the expert. Someone that's done 20,000 butts. That's who I want. That's who I want pelleting me.
Yeah, I was just named, for the last 2 years, I've been named in the top 10 providers in the country. And it's on big old banners all over the place here. Yeah. We're very proud of that. So I continue my education. I follow some of the nation's greatest and just keep learning and learning because every day there's something new. We tend to think we know everything and we don't, but the human body is just amazing. And I've been writing my book. My latest book is on, are you hormone curious?
Because, I want to hear all about this.
Yeah.
And give it to all of my friends.
Yeah, so you'll get a whole stack of them. Yes. No, it's because people are hormone curious. They'll call, but they're not quite sure. They want to stick their toe in the water, but they don't know, is this really for me? And so what I wanted to do is I can say that our pellet system over time with the research that we have helps decrease cardiac issues, helps decrease Alzheimer's, dementia, prostate cancer for guys, breast cancer for women. We have 2 researchers producing studies showing a 30 to 40% decreased risk of breast cancer utilizing our system. So that's crazy good. That's Dr. Rebecca Glazier out of Dayton, Ohio, if you want to look it up. Mm-hmm. I'm very proud of that. But for me, just to tell people that, I wanted to have a book that would back it up with the science. Mm-hmm. So it's Are You Hormone Curious? Bioidentical Hormones Explained by Carolyn Zallmeyer, bioidentical hormone expert. Yeah. And so we go through the history of it like we did with the Women's Health Initiative. Yep. Description, what are hormones, what makes synthetic bad, bioidentical good, and then breaking it down for the different therapy for women and for men as well, because men a lot of times don't want to read the whole book. Right. I want to be able to say, go to chapter 7.
Bullet point.
You can speed through and go to chapter 7. It'll be all about you, and then we can go from there. Right. So it's been fun putting it together. As you know, I'm very passionate and chatty, and so I'm trying to have to scope it down a little bit. But I think it'll be a good book, and I'll be able to give that to my patients and have it available as an ebook online for free from our website. And
wow.
Yeah, so we'll have the printed version as well.
When do you expect that?
I'm still fine-tuning.
Yes.
Hopefully by the end of the year. For sure by the end of the year.
That's
Absolutely.
So exciting.
Yeah.
Well, you know my story. I was diagnosed with PMDD, with premenstrual dysphoric disorder, and I tried so many different treatments for years. I could not find relief from my symptoms, and then I found you. And now I know that you have clients coming from around the world for relief from PMDD.
Absolutely.
I'm so excited.
I know. And you gave me the confidence, and it really made you feel so much better, because PMDD, when I was doing gynecology for the first 30 years of my career, we didn't have that diagnosis. You know, we had PMS, you know, but we didn't have the PMDD. So for me to hear that you feel the relief with what we do was just like music to my ears. And then I could say with confidence, you know, you will feel better, and they do. You know, currently we've been declared the International Center of Excellence for Bioidentical Hormone Replacement Therapy. And with that, I have patients. I have one that flies from Nigeria every 3 months. I have two from Scotland. One's a TV actress. She comes in. And all over South America, the Caribbean, Canada. I've got two coming in today from Illinois. I have two from Hawaii that fly in, which just tickles the heck out of me. I never thought when I started this that people would be actually flying to see me, because I say to them, you know, there's providers closer to you. And they're like, oh, yeah, but it's not you.
Yes.
You know, I want you. I'm like, okay, can't argue with that one.
Yeah. No, your work is truly life-changing. Is there anything else you'd want people to know about your work?
I think you'll probably pick up on it that I care, and I listen, and I don't hide from the telephone. If you're my patient, I answer the phone on the weekends and texts and all that. And that's what you want. You want somebody that, instead of staring in their computer, like if you go to traditional medicine, a lot of times they're sitting there typing in their computer instead of looking at you and listening.
Yes.
And my thing is to ask, how do you feel? You know, what is going on with you? Because everybody's experience is so very different, and I want to fix what makes you feel bad. And that's my goal, and I'll keep going with it, because everybody's different. I can give the same dose of hormone to you and to somebody that has your same weight, height, energy, or exercise, and it'll be metabolized totally differently. So it's a little science. So, you know, I can do the original dosing, then we have you come back for lab tests for men at 4 weeks and women at 6 weeks. And if we need to tweak it, we do it then for no charge. We just want to get you to the happy place safely and comfortably. Because if we give you way too much hormone to begin with, you can, for women, you can have breast tenderness, fullness, nipple tenderness, cramping, you know. So we don't want that. We want to just ease you on up to the level that is best for you.
No, I can attest to this, because that was what we did with me, and we changed the levels. And also, I've emailed you at midnight. I'm like, I need to get in, and you respond. You know, and you make room for me on your schedule when you're getting ready to go out of town. You're
Absolutely.
like, I will fit you in.
Absolutely. I want to pellet people. I want to keep people happy. I want to keep relationships together. I want people's bodies to feel good as we age. I mean, traditional medicine, what they're telling their people now is that to give synthetic hormone, which is not good, for the smallest dose for the shortest amount of time. So say after 50, you get to feel good for a minute, and then we're going to take it away. So the rest of your life, you may have another 50, 60 years left, you're not going to feel well. So I want you to have something that's sustainable, that you can do forever. My oldest patient is 92, and he's still playing tennis.
That's amazing.
I mean, my youngest is probably 35, a woman that had a baby and her testosterone tanked, and I think a lot of times the postpartum depression is related to the testosterone driving down. And she's like, I don't know what's wrong with me. I've got a beautiful house. I've got a great husband. Yeah, I've got a baby. Everything is good in my world, but I don't have that loving feeling. I don't have that chemical drive for relations. And that's not good for a relationship. So I tested her. Sure enough, her testosterone was so low you couldn't even measure it. Replaced that. She came back 6 weeks later like, I'm back. And my husband's so happy. So I always say I make happy husbands.
Yes, yeah.
As well as happy patients.
So they don't complain about the bill.
No. I hear from patients, you know, sometimes, my husband says it's time for me to get a pellet. And I'm like, oh, okay. I had one patient, I was going to do her pellet, and her husband with a Sharpie had written on her buttock, thank you, Carolyn. So it meant so much to him that she was feeling better. And I tell him, yeah, there's hope. I'll bring your wife back to you, you know, your original wife, because you get to feel more like your old self. You know, we don't like how we feel. You're not there yet. You're still young, but when the estrogen leaves the building, it really can mess with you. It can cause depression, anxiety, a whole lot of different things, and it changes who you are. So if we can bring you back to where you were, fabulous.
That's amazing. Thank you so much for your time today, and thank you for the work you're doing to help us age gracefully and feel our best. For more information or to reach out to Carolyn, please visit her website at lowteflorida.com.